problem we had is that the BMA were not prepared to sit around and discuss this in a reasonable way.
So this is a yes. Doctors do still lack the wit to understand the force of the offer you're making.
No, I think that many doctors don't actually understand the contents of the new contract, and nor do they understand how hard the government has worked to try and reach an accommodation, and that's a great tragedy. We've actually had 75 meetings over the 3-year period. We looked at the number of concessions we've made, and I just say this, that I think the reasonable approach for a union when a government is trying to implement a manifesto commitment is to sit down and talk, because this is something that will make the NHS safer and better.
So the manifesto commitment, of course, was to the principle of a 7-day NHS, not to the detail. And the detail is interesting. You mentioned that the doctors may not have read the contract. I've been in touch with a few who have, all 80 pages of it, and the appendices. We know that it positively discriminates against women, especially single mothers. That's contained within the rubric of the contract itself. It's a concession from your own department. We know that under the terms of the new rota, you can finish your shift at 1 or 2 in the morning and yet be expected to start your next one at 5 o'clock the following afternoon. Quite how that allows work-family balance, or indeed travel to and from hospital, is open to some speculation. And we also know that there's no mandate, if you're doing too many hours, for your supervisor to report it to the hospital guardian. So, again, it would seem the doctors may understand the terms of this contract rather better than you're giving them credit for.
Well, it's interesting because all the things that you've just mentioned are areas where we actually reached agreement with the BMA when we had negotiations in February. So the aspects of the contract to do with safety involve...
Everything I just said is contained within the current contract.
Yes, and what the current contract is, it contains, about 90% of it was actually agreed with the BMA when I lifted the imposition of the contract in December to see if we could allow space for negotiations. The 2 outstanding areas of disagreement were to do with the Saturday pay rates and another aspect of antisocial hours working. But if you look at Saturday pay, what we're actually offering doctors is more premium pay for people who work regularly at weekends than nurses, paramedics, than healthcare assistants who work in their own operating theatres, more incidentally than police officers or fire officers. It is a very fair package. And so I think, on that basis, withdrawing emergency care from patients who depend on you is a very disproportionate action.
Doctors are reportedly heading across the borders into Scotland and Wales and Northern Ireland to take up jobs that won't be subject to the current contract. And the general feeling among the junior and senior doctors, most of whom are in support of the strike in this country, is that their profession is being denuded and denigrated. So why not just meet the costs, if that really is the only bone of contention?
Well, let's look at the money we are putting into the NHS. This year we're putting in an extra 3
With respect and answer to the question.
It is a direct answer to the question. You said, why not meet the costs? We are putting in an extra 3.8 billion.
To pay them as they
if you could let me answer the question.
I shall.
We are putting in an extra £3.8 billion into the NHS this year. This government is passionate about the NHS and what it stands for, and this year it will be getting the 6th biggest increase in its history. And part of that additional money is to pay for the costs, the extra costs of a 7-day NHS. But we also know from the mistakes, frankly, of previous governments, that with that increase in resources, you need to have a change in working practices if we're going to be able to offer patients that same high-quality care every day of the week. And what we are saying is, in order for hospitals to be able to roster more people at weekends, we do need to bring down the premiums paid on Saturdays. It's still more generous than pretty much anywhere else in the public sector. But we'll make sure that no doctor's out of pocket by putting up basic pay by 13.5%. Now that is...
But you know that the antisocial banding hours make up around 30 to 50% of many doctors' pay at the moment. So 13% increase in basic pay barely begins to plug that gap.
Well, again, that is misinformation, because they are not going to get no premium pay for antisocial hours. You have lots of small issues, but then you have the issues of substance, and the BMA's own words were that the only 2 ones were to do with pay. And I think many people will say, if it's an argument about weekend pay for a professional, withdrawing emergency care is a step too far.
You must be unhappy about how personal this has become, and the fact that many doctors feel that even if the impasse is to be breached, it would not be achievable on your watch. Is that what you were perhaps subconsciously referring to this morning when you said this would be your last big job in politics?
Quite the opposite. What I've always said is that I want to do this job for 5 years. I want to be the Secretary of State who learns the lessons from mid-staffs and sets the NHS on a path to be the safest, highest quality healthcare system in the world.
Secretary of State, many thanks.
Thank you.